Hi everyone, my name is Mahmoud Saeed, and I'm the regional sales manager for Simulead, responsible for UAE and western side from Saudi Arabia and some countries from Africa as well. Today we are about to talk. We have one of our very important products. It's the TraumaMan system. It's one of the accredited simulators that can be used for the ATLS courses. So it's more today about the awareness and more knowledge about the product. So we'll go through a presentation, detailed presentation, and then we will be going through some videos to show the procedures, and then we go for not live demonstration, but we will see the product live, how it looks, and the texture and everything. So I'm going to start with the presentation now. Okay. Do you see my screen? The voice is clear?
Yes, Mahmoud.
Okay. So TraumaMan Surgical Simulator from Simulab. It's one of our supplier. It's a USA brand. And as I have mentioned, it's one of the accredited ATLS simulator in the market. And it's been there for a long time, specialized for the ATLS courses. So first of all, I'm going to introduce the system. The TraumaMan system is an anatomically correct human body form that allows a student to practice a variety of advanced surgical procedures. Second point, it includes a simulated human torso with a ventilator and 4 anatomically correct surgical zones. We will see this later on, exactly where the zone is located, plus an ankle base for IV cut down. It's a flexible design, and replaceable tissues give each student a first cut experience. And this is something important, that every student will have his own first cut experience, and make it easy to incorporate into team training, team trauma training. It has also been there, as I said, since 2001, and it is accredited for the ATLS courses. As you can see from the pictures, we have the system is coming into the main system, which is the standard, as you can see from the picture, like the TraumaMan system in the middle. And you have 2 add-ons. You can add the surgical abdomen, and this is like optional. And you can have articulating head for more realistic training. But the main system is the exact body form in the middle, which comes starting from the neck to the abdomen, but not including the surgical abdomen. We will cover this later. Moving forward, as the standard system, TraumaMan system procedures, and so this are the procedure that can be done on the standard system without the add-on. So you can do the chest tube insertion, cricothyroidotomy, needle decompression, pneumothorax, tracheostomy, pericardiocentesis, IV cut down, and DBL, diagnostic peritoneal lavage. So these are the skills that can be acquired from using these simulators and the tissues associated with. So here we will be covering the system add-on. You can add, as we mentioned before, you can add the articulating head. You can add also the surgical abdomen, which they call it the catastrophic team training module. And this will allow the trainee for these procedures. First, lacerated kidney, and second procedure is naked aorta, and third procedure is naked renal artery. So this is what you will get if you adding the surgical abdomen. And also you can add the skin, the Sono skin, and this can be used on, to be honest, on TraumaMan or any other simulator, or also on human. So because it's only skin, and this will be used for fast and e-fast examination. Okay, so these are the add-on for the simulator. The features for the TraumaMan, it's anatomically correct. So this is the first one. The realistic body form, skin, and replaceable tissue have the highest fidelity touch and dissection of any simulated tissue available today. So it feels like human. It's very realistic. Realistic bleeding tissues add to suspension of disbelief, enhancing the simulation. Training with TraumaMan is systematic so that each student gets the same learning points with more repetition than is possible with animal or caliber. So as we mentioned before, that every student will get that experience of first cut, and that's something very valuable for them. TraumaMan is the most flexible training platform available for advanced trauma training. It can be combined with high fidelity simulators to run scenarios in team training situations. It is also available for purchase, rent, or lease, and this depends on the program that you are running. So if you are having like one-time program, or you will have it frequent during the year, so you will be able to make the proper calculation for the consumables and the tissues that is required for to cover all of your courses. Okay, moving forward, the basic system content. So it will come from consist of like the TraumaMan body form, which is this part, the replaceable tissues, and the replaceable tissues. We have three types of replaceable tissues. We have the neck, okay, and we have the chest, and we have the abdomen. Okay, and later on we will see how to use it, and every tissue is valid for how many use. And it comes with a ventilator. So this ventilator is being used to push air into the system. So to be used for two things. First of all, like the air into the system, and also the air for the needle decompression as well. And it has the user guide and instructor guide. As you can see, these two files, it comes with it. And the instructors is mainly for the how to replace the tissues and all of these things. And user guide has all the other details. It has also maintenance DVD and also TraumaMan maintenance kit and the dissected DBL sample and a carrying case. Okay. So okay, for the tissue usage per student. So this is mainly, you have the main body form for the TraumaMan, but you will need to get the replaceable tissues every now and then, or exactly as per the number of the student. And the tissues come separate, so you can get the neck tissues separate, or chest or abdomen, or you can get it combined, which is enough for a student. So by doing like some calculation, you will be able to order the exact amount that you need to cover all of your students. For the neck tissue, it can be used twice. So each neck tissue can be used twice, so you can do the procedure twice on the neck tissue. The creek membrane can be used only once. The chest can be used for 4 students, and the abdominal tissues can be used for 4. And as you can see, this is like the chest, and here this X, this cross sign shows where exactly you will do the incision. So which means like 1, 2, 3, 4. So this tissue only is valid for 4 students. Will cover 4 students. It's almost done for the theoretical part. I will be moving to the videos. So I will try to open it. Let's see if it will be clear from here or not. I hope that it will work with sound. So these are all the procedures that can be done. We'll go through the system. So this is the articulating head, the chest scan, and then the abdomen. So this is one of the add-ons. So this is a surgical abdomen, and here they are connected to the standard system. It comes with a small intestine, and as we mentioned, you can do like the three procedures for this using this app: naked aorta or perforated kidney. And this is how the skin looks like, the tissues with the fat and subcutaneous fat and all the layers. So this is the abdomen skin with all the layers, and this is the neck. So we'll be moving through the procedures now. Yeah, you can see the top. So moving down, now they have moved to the different procedure, pericardiocentesis. And diagnostic peritoneal lavage. You can feel how realistic the skin is and the different layers. So here they are mentioning all the layers of the skin. Moving to the chest tube and the needle decompression. And as I mentioned, the system is connected to a ventilator or air source. So once you do the needle decompression, you will feel the air coming out. And here also doing the chest tube, like going through the pleura. Having the tube inserted. And here, one of the procedures uh, for the surgical abdomen. So this is one of the add-on modules for the simulator. Using the retractors, doing the suction for the blood. Done for this one. There is a detailed one for the chest tube, so I will be running this one. This is for the chest tube insertion. We are locating the exact landmark. Doing the incision. Going through the pleura. And here the pop-up sound is very clear in the simulator, but sorry, the video has no sound, but it's very clear. And then they make sure that it's clear to enter the tube. So the tube is inserted. They make sure that all the holes in the tube are all of the holes inside the chest, and now securing the tube. So now I will be moving. Stop sharing my screen here. I will open the camera, and then we'll go through the item itself. Okay, so as you can see now, we have here the item itself. Is it clear? So we will be going through the items physically. We'll see like what parts that we are having here. So this is like the neck side. Okay. So this is exactly where the neck tissue will be located. I'm going to show you. This is exactly the back for the tissues. Okay, this is how it looks. It comes in a vacuum bag, totally secured like this. So, and this is enough to cover, as I said, this is for 4 students. So it has 1 chest tissue, 2 neck tissue, 2 abdomen, and 2 pleural patches as well. Okay, so these are the tissues, but we're not going to put it on the simulator. But exactly, for example, the chest, it has to be like located like this on top of the simulator, and underneath the simulator there is like screws where you will be able to secure the tissues in place, so it will be secured for the procedure. So this is exactly how the tissues look, and also the simulator starting from here. If you have the full setup, you will be having the articulating head, but here it's not. We have only the standard one. So this is where we will be locating the neck tissue. And this is also the creek membrane that will be used. It comes with different one. This one is the surgical, and the other one is like the normal one, which is like not, this one is very flexible for the procedure. For the surgical one, if you get it with the articulated head, the head will be here. We will be using, as I mentioned, the chest scan here, and it will be enough for 4 chest tube insertion. And also we will be using the abdomen one, the abdomen scan here, and it's good enough to be used for 4 procedures as well. And as I said, the system is connected to a ventilator. So this is the main source for the air. Okay. And it comes with these 2 different hoses. One will be connected for the chest tube as the airway, and the other one will be used for the needle decompression. So I hope that I have covered everything. So if you have any question regarding the procedures or what we have covered today, just let me know. Any question?
Can you please show us the internal components, the abdominal ones, and
okay.
the chest tubing?
We don't have the surgical, yeah, but we don't have the surgical one, but I will open it up now. So this is like considered as a like skin cover for the whole body. Just take it from the screws here underneath the simulator. So you can take out the skin like this. Yeah, and actually it's this item, you can get it in different maintenance contract, service and maintenance contract. So it comes with the normal one with 1 year. And if you get it with the 3 years one, you will be able to receive refurbishment kit whenever it's needed. Refurbishment kit, it means this covers scan and also the inside component if any of them need to be replaced. Okay, so this is the body form, and this is how it looks from the inside. And during those 3 years, whenever it's needed, like for example, you have cut in the scan or something went inside the simulator, so you will be able to receive it for free for the 3 years. And from here, you can see the ribs and the lung inside. And also the neck side. So the tissues will be secured here. And as I said, this is like the surgical one. and it comes with a different colored one. It's a pink color, which can be used for the non-surgical procedure. Okay. It also comes with the IV cut down. This piece is also one of the pieces that comes with the system. It also has replacement tissues. It has different layers. So that's it. There is this replacement part also for the surgical abdomen. So if you are getting the surgical abdomen, you will be receiving those replacement renal arteries for the procedure that can be done on the surgical abdomen. But this is like an add-on module, which is not necessarily for the ATLS course. So that's it for the inside of the simulator. Any other question? So thank you. And if we don't have any other questions, so it's my pleasure to have you all.